Well, taking care of your teeth is pretty important, and I'm joined by Dr. Andrew Skasko from Elite Dental to tell us more. How are you doing today, doctor?
Good to see you, Cameron.
Now tell us, you've discovered something pretty amazing that I never knew about. What is it that you've discovered?
Well, it really has to do with thinking about the systemic oral connection. And if we think about the cause of much of our chronic diseases today, it's actually right under our nose.
Wow.
So really what we need to do is focus on what's happening in our mouth and how that collaborates with our physicians and team members that we can put together to really eradicate disease and make a huge difference in people's lives.
And what are the ways to help with that? If someone's diagnosed with something through their teeth, how do you combat that?
Well, it's a great question, and let me kind of pose a scenario.
Okay.
A patient came into our office, and they had spent over $250,000 in medical expenses trying to figure out what was happening.
Oh my gosh.
They had no idea. They had MRIs, they had CT scans, $250,000 of our medical expense dollars. There were simple things that needed to happen in the oral cavity that really could have changed everything.
Who would have thought?
Within 4 months, we were able to eradicate disease, take care of the infectious teeth, and the patient not only felt better, she had more energy, she was more active, and all of this could have been prevented. So it's right under our noses, and we hadn't realized, the literature's there to support it now, we just hadn't realized what was happening in the mouth is so collaborative and correlated to what's happening in the rest of our body. Inflammation in our mouth is inflammation in our body.
This really is like the future, it seems like, of dentistry, because someone comes in, is that something that you notice now? It's an additional thing that you look for when your patients come in?
Absolutely. We've developed very specific standards as to how to screen for all types of systemic disease: stroke, diabetes, cardiovascular diseases, Alzheimer's. We've got situations where people are dealing with stomach acid reflux. Now, the beauty in dentistry and what's happening in our profession is we're not treating all of these diseases. We're on the front line of the opportunity to help diagnose and then get them to the proper physician colleague that are a part of our teams. And so this is complete health dentistry.
And why is it, you know, just for the way my brain works, what is it to do with the teeth that you can actually see them? Is it the nerves specifically? Why is that?
Well, there are specific bacteria, whether it be soft tissue bacteria or hard tissue bacteria, which would be specific to your teeth. Those type of bacteria are what are affecting or infecting the rest of your body.
Wow. So if people are interested and they do want to come see you, how can they get a hold of you?
Our office is Elite Dental. We're in New Albany. And basically what I would do is look for a complete health dentist near you. Our practice is a complete health dental office, and I will say that complete health dentist and our hygienists and everything that's going on in dentistry, we can help save a life. And that's really, really amazing.
And especially during this time of year, you know, the flu's going around, many types of sicknesses, this is an opportune time to really just get your teeth checked and go in for the cleaning, and that way they can see something if something is going on. Is that right?
Absolutely. If you haven't seen your dentist, make an appointment today. It could be life-changing for you and life-saving.
Well, doctor, thank you so much for joining us today.
Pleasure to be here.
So great to learn that. What insight. Wow.
It's amazing.